so slow. But let's have patience. We have 1 minute more. Okay, it's getting connected. So, so remember. Hi, Mario. Hi, Johan. Well, everybody's coming. That's great.
Hello. Good evening.
Hi, Johan. How's your weekend?
Very good. What about you?
Well, interesting. Lots of work too with my kids. My children got sick. And well, anyway, it usually happens, right?
Nice, nice. The family is first.
Yes, I have 3 children and 2 of them got sick. And it's worse
Really?
than shifts. But patience.
Yeah.
With in shifts, at least I have a nurse helping me. With my kids, nobody. It's not the same when they call mama or call somebody else, right? Well, let's say 8 p.m. Do you want to expect a little more? We are just 8 people. We are supposed to be. It's not as long as the last class, but it has few topics to prepare to check. Can you see my screen?
Yes.
Yes, we are now in the PowerPoint. I wrote.
Hi.
Oops, yeah, okay, a little bit. Hi, Ruth, how are you? I own you the workshop, the last one.
Yes, I know.
We couldn't meet each other. No, we couldn't. That was many unexpected situations. I was almost dying, but I'm sorry.
It's okay, don't worry.
But now, okay. Can you check
I
screen? It's a blue one, I mean. So today, yeah, the next one we are going to get in touch to get in common for having an extra time because you were asking for it. So now I understood. I made the mistake. I'm sorry. But don't worry. We are going to have the moment for solving the doubts. First of all, tomorrow in the workshop, we are going to talk about the case report because I received many, of course, lots of homework from yours, but some of them are not correct. I must be sincere with that. Some of them have a huge idea what we are talking about, but others are not the job I was expecting for. But there's no problem. That's the objective here. It's learning. And we must understand from now that a case report is not the same as in Spanish. A case report is a very simple way to work on. So from next class until the end, we are going to, I mean, this model 1, model 2, we are going to work with lots of case reports for not making any mistake. And when in the model 2, when we get into the clinical history as a fact, with all of the topics it has to take, so we are going to have a better way for writing down, okay? This course is short, I know, but in the shortness we are working, we have the opportunity of having so many details and topics for having lots of information. And I know that we need lots of time for homework, assignments, and quizzes, but it's a preparation for the final test, because all the questions I'm writing down for homework are the basis for making the final test, okay? So I know 12 pages, 14 pages, it's a lot, but well, that's what I was trying to make with jokes. I mean, having fun with crosswords, puzzles, and scrambled words. I mean, but there's another way for understanding these ones, and model 2 is going to be so easier if you make everything that now we are doing. Well, any question about it before starting? Because as I was telling you, we have lots of topics to check today. Anything you would like to say, maybe? Something you would like to ask? Well, okay. So let's start, okay? In this class, we are going to watch the endocrine system, gynecology, pregnancy and birth, and childhood. Of course, not in the way that we expect for, because these topics are around 2 years of studies. It's a lot of time that has to be resumed in an hour and a half, maybe. Okay, so let's do it. About the system, I mean, now we have for almost the topics we are making. Any volunteer who would like to read it, I'm taking it in count, okay? Hello?
I can read.
Okay, please go ahead.
Major structure, adrenal glands, relay combined forms or adrenal. Primary functions, regulate electrolyte levels, influence metabolism, and respond to stress. Gonads, relate gonad or gonado. Primary function, gamete, production glands. Male testicles,
Yes.
or relate testic or testicle. Primary sperm producing gland, and female ovaries, relate ovario, primary functions, ova, egg, production gland, pancreatic islets, relate combining pancreas or pancreato, control blood sugar level and glucose metabolism. Paratory gland or paratorio or paratory.
Parathyroid.
Paratido or paratido, regulate calcium level through the body. Pineal gland or pineal or pinealo, influence the sleep wakefulness cycle. Pituitary gland, pituit or pituitaria, secrete hormones and control the activity of the other endocrine glands. Thymus, thyme or thymo, plays a major role to the immune reaction. Thyroid gland, thyroid, stimulate metabolism growth and the activity to the nervous system.
Okay. Pancreatic islets. That's great. Okay. No. Well, our word parts, that of course in grammar is going to be so helpful. That we know the prefix and suffix, of course, and details for having the meanings, okay? It's going to be so helpful by tests and homework. Well, our anatomical review, of course, we have to check all the anatomical parts and correct writing down expression, I mean, parathyroid glands in posterior, the thyroid gland, of course, hypothalamus, pituitary gland, pineal gland, adrenal glands, ovaries, testicles, pancreatic islets, and of course the number of them. That's just a check that I'd like to share with you. The gonads, of course, either pair of ovaries in females or pair of testicles in males. That we know it's a simple one because I didn't want to get it in confusion. It's so abstract. I mean, the endocrine system about work, okay? So another picture showing the pituitary gland, how it secretes hormones that control the activity of other endocrine glands. Okay, there's the legend. So we can check it, and of course we have lots of abbreviations in the way we are going to study. Okay, most of them are the same as in Spanish, and then we can work on it in a huge idea of what we are doing or with this. More anatomic review. The pituitary gland, hypothalamus, pineal gland, the parotid, with a little closer, I mean, just for having details, okay, for checking. We must talk about these interesting excess and deficiency concepts. Excess, of course, too much. Deficiency, too little. Please, John Harold, can you read the excess part, please?
Yes. Excess and deficiency. Excess equals too much. Where there is an excess of hormone, one way of treatment consists of giving medication that inhibits the production of that hormone. Example, hyperthyroidism is treated with carbimazole.
Carbimazole, perfect. Thank you so much. Johan, are you there? Can you listen to me?
Yes, I can hear you.
Yes, please, Johan, can you read the deficiency line, please? Deficiency.
Deficiency, too little. When a hormone is deficient, treatment may be by replacement therapy. Example, type 1 diabetes is treated with injections of insulin.
Okay, of course we know this vocabulary, okay? Replacement therapy is one of the most important concepts we must get while studying and reading, because we are going to check it in not only in this lesson, okay? Maybe in the oncologic lesson and some of them. Deficiency and excess is a very important concept from starting talking about. So we almost have to talk about the negative feedback system, because we have lots of vocabulary here. Catherine, can you listen to me? Well, I think she's not there.
Here, teacher.
Yes, can you listen to me? Okay, Catherine, please, number one. Just it, okay?
The thyrotropin relation hormone is secret in the hypothalamus.
Yes.
triggers the production of TSH, thyroid stimulation hormone in the pituitary.
Perfect. Thank you so much. Mario, can you read the number 2, please? Can you listen to me?
Yes.
Yes, go ahead, Mario.
TSH stimulates the TSH receptor in the thyroid to increase synthesis of both T4 thyrotoxin and T3 T3-thyronine, and also to release stored hormone, producing increased plasma levels of T4 and T3.
Perfect. Ariana, can you read number 3, please? Can you listen to me?
Yes.
Yes, thank you. Go ahead, please. Wow.
And perhaps the hypothalamus to inhibit DRH and TSH secretion.
Okay, sorry, Ariana, the audio is almost lost, but don't worry. Belkin, can you read it, please? I know we have connection problems. There's no problem. Belkin, are you there? Ooh.
Hi, I'm here.
Yes, please, Belkin, just read number 3, please, again, because Ariana's audio is not okay, maybe connection problems. Number 3, please.
Okay, can you hear me?
Oops. Yes, clearly.
Okay. Feel free. Feedback on the pituitary and perhaps the hypothalamus to inhibit TRH and TSH secretion.
Okay, perfect. Thank you, Belkin.
You're
So
welcome.
as I was telling you, this process we were studying at the university, and it's a kind of I don't know, kind of hard to explain to understand in the first reading, but while practicing we understood it because it's around 1 semester of this topic just, and that's great, of course, to remember how it works. And the best part of it is that we are gaining some vocabulary with the specific ways of talking about it, about hormones, and how we can use it in the correct way, okay? The secreted expression is not a common way of talking, right? It's secreted in the hypothalamus and triggers the production. Of course, triggers is not a word that we are going to use all the time. So this vocabulary try to get for yours, and of course, we are going to work on it this week. Goiter. Okay, goiter is a very common situation that almost all of us were checking it while during the career. And of course, I think maybe we had an experience with a patient in front of us in view, okay, watching them, treating them, asking for information, making a clinical examination, because that's not something that we could forget as easy as we think, okay? Agar, can you read please this slide?
I'm gonna try. There is not a good communication.
Okay, try it. If there's not a good audio, I'm going to read it again. Don't worry.
Okay. Enlargement thyroid gland might be diffuse, involving most of the gland, or localized limit to a particular area, as is solitary, single, or nodule. The increased blood flow in diffuse enlargement might give rise to a palpable
Okay.
thrill, vibration felt with the hand, and audible Breath, breathe,
The bird.
nose,
Uh-huh.
nose heard through a stethoscope over the gland.
Yes. For example, have you ever had a patient like this one in the picture? Any of the class, you mean, anyone could have the opportunity of evaluating a patient with this specific situation?
Yeah.
When I was at the university, I had one, and those findings were amazing because we were in the fourth year and we said, wow, what's going on here? That's amazing. And an amazing sound and palpable situation that, of course, we are not forgetting it as easy as we think. Anybody did it too? Someone watched a patient like this, maybe bigger or smaller, and I don't know.
Yes, but smaller, not that bigger.
Yes, it's an extreme situation, right? Obviously, maybe has another extra pathology. But this picture, I thought when I saw it, I said, okay, this one is going to be clear about the concept of goiter, a very common situation in Latin America. He doesn't want to go ahead. Sorry, he doesn't want to continue. Well, one of the most common causes of it, of course, we know this, the less consume of salt, of iodide salt, okay? So just for remembering. Goiter is just an example about what the excess and deficiency kind of hormones we are not receiving it for having a correct and sane negative feedback systems, and of course avoiding these situations. This example is one of the most common ones that we are going to watch. Of course, it's the Cushing disease 2, the Graves' bacillus 2, and many situations that we're going to check ahead. As now the endocrinologist here in this room, we must understand we have to refer this kind of situations while being a suspect to a specialist, specifically to the endocrinologist, right? So we have here this missing example. When we said, dear doctor, we are not asking for like friends. We are not presenting as like trying to get in favor, something like that. Dear doctor is a very formal expression in medical English and very respectful expression about talking with a superior doctor, with a professor maybe, or with someone who is a specialist and of course has more studies than us. This situation is going to be very important to get clear because dear doctor is the best way of expressing this kind of letter of referral, okay? If we omit or use another kind of expression, it's going to be misunderstood the sense of the formal way of talking. So dear doctor, is the most common and the best way of expression, as I was telling you, okay? A volunteer maybe for reading this example, just the letter, and then
Can
we can continue. Yes, go ahead, please.
Okay, dear doctor, I would be grateful if you will see this 50-year-old woman who has lost 20 kilos in weight in spite of eating more than usual. She describes herself as overactive and fears she doubts the weight loss has due to this. But more recently, she has developed palpitations, diarrhea, and heat intolerance.
Diarrhea.
Diarrhea and heat intolerance. She has noticed that her hands have a tendency to shake. Her symptoms suggested hypothyroidism, and this was confirmed by examination with relevant
Hyperthyroidism.
thyroid, red sweaty palms, and fine tremor of the hands.
Okay. Okay, we have diarrhea, the pronunciation topic, the head intolerance, hyperthyroidism, thyroidism, so it depends on fine tremor, tremoras in Spanish. Okay, of course we have here the meanings of the medical explanations. At the beginning, the doctor is expressing kind of the symptoms the patient was explaining for him. And then in the second paragraph, he is explaining to the doctor with the medical term, the fine tremor, of course, the tendency of kind of deviation in the first paragraph and the second paragraph. The first one explaining the symptoms is very important for the specialist when receiving the patient to get an idea how he's going to ask for the patient, because with this kind of example, we can the general view how is the best way of communicating with the patient. Of course, it's not the same to talk with a common citizen, an engineer, for example, a lawyer, or maybe a professor, or someone who is without studies and an analphabet, than talking between doctors, between colleagues. And of course, in the second paragraph, don't forget to use the medical explanations, okay? Now checking just for having the topics, we have the pathology of the end, okay? The syndromes, I don't know, specific situations, excess or deficiency of hormones. It's not an easy diagnosis to make, but we must have the idea or what we are looking for, right? And lab tests and more details for too. That's why I'm not taking these specific situations of how we diagnose it, because at this moment it's not a topic, okay? The chart is going to be so helpful. I mean, diabetes is here in all of the situations I remember. Talking about emergencies too. I had the opportunity to check the diabetic coma and the insulin shock. It's not an easy situation. And maybe someone would like to read some of these situations, not on the chart. A volunteer, maybe.
I can read it.
Okay, go ahead, please.
Pituitary gland, acromegalia, gigantism, hyperpituitarism, short stature, pituitary adenoma, functioning, non-functioning, galactorrhea, prolactinoma, galactorrhea, antidiuretic hormone condition, diabetes insipidus, syndrome of inappropriate antidiuretic hormone, pathology of pineal gland, pinealoma, the thyroid gland, thyroid carcinoma, insufficient thyroid secretion, Hashimoto disease, hypothyroidism, cretinism,
Hypothyroidism.
hypothyroidism, cretinism, and myxedema.
Yeah.
The parathyroid glands, hyperparathyroidism, hypercalcemia, hypoparathyroidism, hypocalcemia, excessive tidal secretion, thyroid nodules, tidal storm, hyperthyroidism, Graves' disease, the pancreas, insulinoma, pancreatitis, abnormal pancreatitis, abnormal blood sugar level, hyperglycemia, hyperinsulinism, hypoglycemia.
Anyone who would like to read it? Thank you, Ruth. I don't know. Any volunteer for reading the second chart? It's not as long. I mean, the other charts were long in count participation. Well, maybe Joyce, are you there? Can you listen to me?
Yes, I'm here.
Yes, please read this chart, okay?
Okay, from the beginning, the thymus.
Yeah, from the thymus until the end, okay? Thank you so much.
Sure. Okay. So the thymus, diabetes mellitus, metabolic syndrome, type 1 diabetes, the adrenal glands, Addison disease, the gonads, hypergonadism, type 1 diabetes, adrenalitis, hypogonadism, type 2 diabetes, aldosteronism, gynecomastia, not sure about that. Prediabetes, Cone syndrome, latent autoimmune diabetes in adults, LADA, pheochromocytoma, gestational diabetes mellitus, Cushing syndrome, hypercortisolism, and diabetic emergencies, diabetic coma, insulin shock, diabetic complication, diabetic retinopathy, heart disease, kidney disease, peripheral neuropathy.
Perfect, thank you. So as we can see, all of the situations are very common, lots of them. Some of them are a real problem in our health structures of working in our countries, and we must know about it, okay? Well, of course, abbreviations, few of them, I couldn't get all of them because the book didn't have more, but I share it with you because it's important for us. Please, next homeworks, we're going to use more abbreviations, okay? And just for information, it's going to be so helpful. Now let's talk about gynecology. Of course, it's about woman health situation, specifically for us, for girls. But it's important for everybody to know it and to understand that we are not as not present in this whole process, because without a woman, we are not here. I mean, boys, you understand it better than everybody. As always, our anatomical review from the external genitalia, the mons pubis, purpose clitoris, the urethral orifice, glands of clitoris, Bartholin's glands, the labia minora and labia majora, of course, Latin again. We know Americans love to mix Latin and English. And again, going to at the structures of the female reproductive system in the lateral cross-section. The uterus, specifically this schematic view, that it's important to check all the parts and all the topics it's showing us. The tissues of the uterus, of course, are important. I know, the fallopian tubes and everything. Now talking about breasts, we have these body parts with definition, of course, is going to help us with some vocabulary ways of expressions. The nipple and areola, darker skin on the nipple. That's interesting. I liked it for sharing you. And of course, our common picture for remembering all the spaces, okay? Just wall, ligament, muscle, lobes, ducts, ribs, body tissue, lymph nodes, never forget it, blood vessels, the really nipples. Extremely important to check, and the people have to check it, okay? Our patients, of course, are so important. In this opportunity, we have to understand that the reproductive system, of course, not just for girls, of course, boys are able to. The male structures and the female structures, of course, are different. And I decided to show this chart because we are not just talking about female structures, okay? So in that order, just for having an idea, the male structures, the penis and the testicles, are important to get these related combinating forms, the penny and the fall, or orchid, testi, and testo. And of course, the primary functions that we know about it. About female, the ovaries, fallopian tubes, uterus, vagina, and placenta are the most important that we are going to check in this part of the presentation, okay? The male structures, a little bit, we were talking about it in the last class, and now we can get another idea, okay? So we have here more expressions for talking about, for example, ovaries, the ophor or the ovary or ovario, produce ova, produce eggs, and female hormones, okay? The fallopian tubes, the salping or salpingo, catch the mature ovum, catch the mature egg, and transport it to the uterus, also the site of fertilization, right? The uterus with histero, hister, metro, mitro, metri, metro, metrio, the utero, products and supports the developing child. The most important function, of course, the vagina, vagin, vaginal, colpo, used for sexual intercourse, act as channel for menstrual flow, and functions as the birth canal. Okay, very important structure. The placenta, the placent or placenta, exchanges nutrients and waste between the mother and the fetus during pregnancy. Of course, the organ that women develop during the pregnancy. And we're finishing its throat. It's going away. Our word parts, important to know it, remember, as a suffix, of course, very helpful, I mean. And menstruation, we have lots of and to express to get that information, okay? Let me see who's there. Give me a minute, please. Maybe Johan, can you listen to me?
Yes.
Is that okay for you reading the first part?
Okay. A period, menstruation. A period is the common name for a menstrual monthly period. The one set of menstruation is known as menarche. 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 The last.
Yeah.
Okay, give me a second.
Go ahead, please.
The last menstrual period is commonly abbreviated in doctor's notes LMP. 2:52 ago means the last menstrual period was 2 weeks ago. The menstrual cycle or length and frequency of periods is usually written in the form 428, which means lasting 4 days and occurring every 28 days. If a period lasts more than 4 or 5 days, it can be described as prolonged. The term heavy period means excessive blood loss. Menorrhagia, often with the passage of clots, coagulated blood. The term period pains means dysmenorrhea and painful menstruation.
Good. Thank you, Johan. From this information, we have a very important part for grammar, the abbreviated in doctor's notes, LP. Don't forget the abbreviation to write down examples in the workshop, and then you're going to traduce it. So it's important to understand it, okay? And well, the menstrual period is in that way. And the forms of expressing the menstrual cycle is one of the most important topics of this class, I mean, because it's going to be extremely useful. So let's go ahead. Mario, can you read the second paragraph, please?
Yes.
Yes, go ahead, please. Thank
Okay,
you.
the second paragraph. The time when a woman stops menstruating, normally at about the age of 50, it's called menopause or climacteric. In everyday
Perfect.
English, it is known as the change of the life or simply the change. Symptoms.
Hello, maybe connection disturbances. What?
Yeah, what was the last word you hear?
Yes, symptoms of the menopause.
Okay, symptoms
We
of the
stood there.
menopause include hot flushes, sudden sensation of heat, and night sweats.
Night sweats. Perfect. The hot flashes are awful. the worst part, because you are quiet and then whoosh, you feel a hot flash and it interrupts all the activity you are doing. And of course, it goes with the behavior changing, the mood changing, and it's not a comfortable situation for living, okay? The night sweats are very common too. It depends on where you are living for. We have as an example the phases of the menstrual cycle, the menstrual phase, post-menstrual phase, ovulatory phase, premenstrual phase. Okay. Here we have a few vocabulary for understanding, for reading, taking maybe some notes. I'm talking about it just for getting more ideas about expressions, okay? The menstrual phase, these are the days when the endometrial lining of the uterus is slacked off and discharged through the vagina as the menstrual flow. Approximately days 1 to 5. The post-menstrual phase, after the menstrual period, the pituitary gland secretes follicle stimulating hormone, the FSH, causing an ovum to mature. Estrogen, which is secreted by the ovaries, stimulates the lining of the uterus to prepare itself to receive a zygote, the fertilized egg. Approximately days 6 to 12. Ovulatory phase, on approximately the 13th or 14th day of the cycle, ovulation occurs. Ovulation is the release of a mature ovum. The mature egg leaves the ovary and travels slowly down the fallopian tube toward the uterus. During this time, the female is fertile and can become pregnant, approximately days 13 to 14. Premenstrual phase. If fertilization does not occur, hormone levels change to cause the breakdown of the uterine endometrium and the beginning of a new menstrual cycle, approximately days 15 to 28. Of course, it's not as exact in the days that the example is showing, but it's an idea we get during the med school, right? And we have our graph, our picture. Without pictures, we don't study. I understood it while finishing the university. We have the days in the line on the floor, and then we have the levels of hormones in relation of the days, and then the menstrual cycle while it grows and gets lined out, okay? And how the menstruation, the FSH is working on during the menstruation, estrogens and LH is working, the ovulation, how it works and how it is delivered from the ovary and ahead, okay? The menstrual pain symptoms, the most common we have here. Of course, symptoms are very important while we are talking with our patients. Abdominal pain, increases the chest, the breast, back pain, headache, bad humor, maybe changes in mood. We love candies. What can you do? Of course, diet, taking pills, a massage. It's very comfortable. Something warm, try to sleep, exercise if you consider it's not important for you. And we have a better example about how to ask in a gynecological consultation, okay? I'm into volunteers maybe. Could be one Agar, please, are you there?
Yes, I'm here.
Okay, Agar, you can be the gynecologist. I'm gonna be the patient.
Okay. Are your periods regular?
Oops, I think we have. Agar,
I'm here. Are your
can you come
periods
back
regular?
or? Hi.
We had bad connection.
Okay, so don't worry, we're going to read it later with you, okay? John Harold, can you listen to me? John Harold?
Yes.
Yes, okay, let's make this exercise, okay? You're the gynecologist, I'm going to answer you.
Okay. Are your periods regular?
Yes,
How often do you get them?
every 4 weeks,
How old were you when you started to get them?
about 12.
When was your last period?
A week ago.
How long do the periods last usually?
4 or 5 days.
Would you say they are light or heavy?
Light.
Do you get clots?
No,
Do you get period pains?
not really.
Is there any discharge between the periods?
A little.
And what color is it?
White. Thank you, John Harold.
You're
So
welcome.
as you can see, these questions are not a comfortable situation for answering because of the ways the patient is talking about. And we must understand that this, of course, very common situation. But the way we are asking for is the important part we have to remember. Using the correct words, for example, periods regulars, or how often do you get them, the correct verbs. About the last period is an expression that we cannot change. I tried, I was looking for synonyms and I couldn't find them. And of course, how long do the periods last usually? This is an important question that not all the people know it. And this is the correct expression because any other expressions could be misunderstood and get into confusion with the patient and get in an offensive situation. About clothes and pain, of course, it's important to know it as accompanying symptoms. And the color of the right. The discharge is important to know about it in order to look for infections, I mean, right? The most common, the condom, the female condom, diaphragm, hormonal rings, the UID, the intrauterine dispositive, I mean. Hi, I'm sorry, I had a little trouble with my connection, but this going, it's getting corrected, okay? Now, can you see my screen? Hello, everybody, can you see my screen now? Can you
Yes.
listen to me? Okay. Perfect. So we have these methods as a general view. I mean, I was explaining you. How well do this control work? How trustable are them? Of course, we have from the less effective to the most effective ones. And just for information and getting the idea that it's important, okay, to know about it. Let's go to the pathologies of the gynecological system. That's not so much information, but that's the most common ones, okay? Any volunteer? Maybe Ariana, if you get corrected your connection trouble, maybe.
Yes, I would like to read.
Okay, go ahead, please.
Okay, ovaries, fallopian tubes, and ovulation. And ovulation, ovaries, ovarian cancer, ovariorexisis, and pelvic inflammatory disease, the polycystic ovarian syndrome, pyosalpinx, and salpingitis. Uterus,
Yeah.
endometriosis, metrorrhea, endometrial cancer, uterine fibroid or myoma, uterine prolapse, cervix and cervical cancer, cervical dysplasia, cervicitis, and endocervicitis, vagina, colporexis, dyspareunia, leukorrhea, vaginal candidiasis, and vaginitis.
Candidiasis, that's okay.
Candidiasis and
Okay.
vaginitis.
Okay, go ahead with the second one too, please. Peritus vulva, I'm sorry, I forgot.
It's okay.
External genitalia.
Genitalia. Peritus vulvae, vulvodynia, and vulvitis. The breast diseases, breast cancer, fibroadenoma, fibrocystic breast disease, galactorrhea, mastalgia, and mastitis. The menstrual disorders, amenorrhea, dysmenorrhea, dysfunctional uterine bleeding, DUB, hypermenorrhea, hypomenorrhea, menorrhagia, oligomenorrhea, polymenorrhea, premature menopause, premenstrual syndrome, and premenstrual dysphoric disease.
Perfect. Thank you, Ariana.
Thank you.
So all of these situations, of course, we know we were studying, and we must try to get all of the information of some of them, okay? And of course, more abbreviations to remember to study. And these ones are taking some abbreviations that are coming into the next topics, okay? So let's go ahead. Have you ever seen this picture? Have you ever seen the history of this pregnant woman? Any of you maybe could hear about the body exposition that is very popular in Europe and Asia. And it was supposed to come here to Bolivia in the first Latin America view of this kind of models. Well, giving an idea, Bodies Exposition is a traveling museum that is made with complete patients' bodies that were donated to research, specifically to research, but not the common research in the way in a medical school or lab tests or something like that. The research about how people react, showing and watching that kind of a specific body corpse without the skin, body movements, situations, sicknesses, illnesses. And this woman is one of the most important pieces because she was 8 months in pregnancy. Nobody knows exactly which body is coming from, families or relatives or someone who could recognize a relative in the exposition. But this girl, this mother, is a huge situation because it's supposed to be a disappeared woman from Hong Kong that was pregnant from a politician. And the one, I don't remember the name, that girl disappeared while pregnancy, and months later appeared this piece into the exposition, and they said that it's this girl from Hong Kong. It's just a mystery. Nobody knows if it's real, but this shows us how the body changes with the fetus inside the body. Okay, and it's a very impressionant, very important and impressionant view. Okay, so let's go ahead. Let's continue. I'd like to share it because it's an interesting. If you can look in the internet, you could find almost all the exposition. It's very interesting, a very interesting way of watching the body, the movements, the sickness, the different situations. And I recommend you. It's an important fact. Now let's talk about pregnancy and birth. Pregnancy, of course, is one of the most important periods in a woman's life, okay? In order, it's not the most common situation. It is not possible to happen all the time, all years, because of the clinical consequences. And all the situation it involves shows us the great paper I think we have in society. Without women, we don't have new people. Of course, we know it. In these pictures, I was just trying to show you the view that we are expecting from a baby, from babies, I mean. Oh, I got it twice. I'm going to change it before sending you. And of course, we must consider our mothers because of the body changes we experiment during this period. From this bowel situation, we go into this this change, of course, uncomfortable situation for eating, breathing, moving. Of course, breasts are too small and then got so big in order to feed the baby, and that's important, okay? In order to understand these changes, we can understand the physiology of this period that is very delicate one, just for information. Childbirth, of course, is a very important topic when when she's expecting or this pregnancy. I mean, even though she's not, because we know that it's not an easy job to do to our arms. Okay, big ways of explanation. Okay, the expected date of delivery, the EDD, is the date on which a woman is expected to give birth to a child she's carrying, a pregnant with. It's calculated by adding 2,080 days for 40 weeks to the first day of the last menstrual period. We have some formulas to get it into account. And that's just from me, okay? The particular expression, but it's very common to read it in some articles, okay? Delivery is the process of helping the child to be born. A spontaneous vaginal delivery, SVD, is a normal delivery. We have the picture. If there are complications, the baby may be delivered by a cesarean section, surgical removed, or maybe a C-section, just C-section, that's the abbreviation, okay? And we have the picture, we have the images for supporting it. Childbirth is very, shows us as mothers how our life is going to change completely. There is no way of understanding that anything would be as it was before the pregnancy. Okay, after we have our kids in arms, our babies, then we notice the change of it. Joyce, can you read this slide, please?
Sure. Give me a second. Okay. So a full-term pregnancy is 40 weeks divided into 3 trimesters. A baby who's born before this is premature, and one born after 40 weeks is postmature. A baby who's born dead, for example, because the umbilical cord is around the neck or its neck, is stillborn.
Thank you so much. Why do we say its neck? It's the fetus a person or not a person? It depends on the place you are talking about. Here in Bolivia, talking about fetus, it's not a person until it gets delivered and cries. After that, it's just a piece of the mother's body. It sounds so hard, but that's the way that laws are protecting the mothers from this situation, okay? In other countries, on the other hand, on another side, fetus are considered people while they are during the pregnancy process, while they're growing up into the mother. That's why they have specific rules for protecting fetuses, and then can born and then have some warranties of living, I mean. That's why abortion is a huge problem in many situations. In Cuba, for example, as a place that abortion is a legal activity, a fetus is just a piece of the mother, and the mother decides what to do. When I was a student, it was valid for the whole pregnancy term until the 24 week, I remember. But in changing policies and studying the society, they noticed that they were without children, and making the statistics and studying the society development, they noticed that they would be without children at the 2020. I'm talking to you about the 2005 when I was there. And they said that it was not possible to be without children because they are an elderly population. So to be without children is an awful situation. So they decided to change the ages, the stages of abortion, okay? And of course, there are not going to be stillborns, but they're going to oblige women to continue with their pregnancies after the 14th week. Before that, they could make abortion as a legal rule, by free, I mean. A pregnancy might end term spontaneously with a miscarriage, a spontaneous abortion, that is a very common situation, or be deliberately terminated with an induced abortion, termination of the pregnancy. As I was telling you, in Cuba, it's a loyal way to use induced abortions because that's a way that they decide to work on. That's just their policy of living. Many in our countries, it's not a legal situation, but we must know that it happens and it's going to continue, okay? The miscarriage, of course, has many implications, psychological implications, physiological implications, as we know, but it's supposed to be spontaneous. And we have, of course, the stages of it, and we know how to work about it as a doctor, as we are. To be in labor, well, it's the process with the fetus and the placenta. Delivery of the labor. Labor is a common expression in United Kingdom, delivery in the rest of the world. I don't know why they like to mix some of those concepts, but that's okay. And we consider the cervical effacement, the changes that the cervix suffers during these periods could be minutes, hours, or maybe 1 or 2 days. And we have the childbirth, the 3 stages of childbirth. Okay, we have the stage 1, the cervix relaxes, causing it to dilate and thin out. 2, stage 2, uterine contractions increase in strength, and the infant is delivered, the fetus is delivered, and stage 3, the placenta is expelled. So we must remember and look for this specific vocabulary, for example, expelled, because we are not talking in the same way with other specific situations, right? It is spontaneously, it's harmfully, it's not comfortable, it's not just wait and it's going out without pain. Of course, it's painful too, and we must understand it, okay? And we have times for respecting it. So the dilatation, as I was saying, it could take some hours. The birthing is about 3 hours or so, from 50 minutes to 3 hours. It's terrible. And the placental, we must spend 30 minutes, no more than this. Why 30 minutes? Because of the physiological changes it suffers into. And the 4 stages of labor, it's not the same. These stages, when the baby is pulled out, and these other stages, there are 2 different situations, okay? First stage, the woman has contractions and her cervix dilates. The second stage, the woman pushes, giving birth to the baby. The woman expels placenta, and the postpartum period. The postpartum, that it's not always taken in account, but it's important to show it as the 4th part and the continuously part. We have this picture for having a better idea with a little explanation about the labors. I'm going to correct this these details in the picture in order for reading correctly. And about studying the fetus, we have the presentation and lie. It's important for us as doctors to make the correct evaluation of the fetus, of the baby that is growing up into mommy's abdomen, I mean, in the uterus. How the tummy changes and how babies are getting in position or not for that important moment that is the delivery. For example, the fetal lie is the position of the fetus in the uterus. The normal lie is longitudinal and the abnormal lie is transverse. We know if the baby is longitudinal with a vertex presentation or cephalic presentation, that's perfect because it can happen. The delivery is going to be okay. If the baby is longitudinal lie but has a bridge presentation, the baby is stood. It depends where we are and if we have enough time and if we have the experience of helping in this delivery. And of course, it's better to go with a C-section, but if we cannot do, if we are extremely away, we can consider a delivery. Okay. But in a slide shoulder presentation and medial this in transverse we can do nothing, no try of moving, of mantear. They get into a frazada, I don't know how to say that, how to express it, and they play with the mother until moving the baby, but it's not a warranty. During this situation, usually the placenta disrupts, and of course the baby gets a stillborn, and it's not a situation that we expect of it. The fetal presentation, as we were talking about, is the part of the fetus which occupies the center of the pelvic and canal and which the examining fingers feels on vaginal examination, the butterwort. The normal presentation is with the head, the vertex presentation as in the picture, okay? And the bridge presentation. I had the experience to act, to receive, to help in a deliver with the frank bridge presentation and the incomplete bridge presentation. This one was horrible, was terrible because we couldn't do anything with the baby. And of course, it was born with a C-section as a stillborn. On the frank presentation, my doctor was so capable to do it, and the baby go ahead and was born completely sane. Everything was okay. But with the incomplete presentation, we couldn't do anything. The baby died. Was stillborn, and the C-section was the only solution we could find for solving this situation. We have more presentations just for information and for getting the correct expressions for talking about it, I mean. And now the last part, and I'm sorry for being too long, we must talk about childhood. Childhood is one of the most marvelous periods in life, I mean. Johan, can you read these slides, please?
Of course. Childhood is the period during which a person is a child from birth until puberty. Puberty.
Until puberty, right. Thank you so much. And we have the milestones. The milestones is a child's development by age. The most important topic we must check during the baby is the newborn and goes ahead through life, right? During the childhood. Of course, we have topics, milestones to consider and to continuously be evaluating about the baby for having an idea how this baby is growing up and how this developing and learning from the surrounding world and how he is going to be into the brain development and the brain activities are related to. It's I liked it because it's so nice how it expresses the situations when baby are doing the milestones. We have one more with a little more details, but not at the same age as this. It goes until 24 months. It finishes in 18 months, but it has more details except for exactly words to use for. The developmental milestones, if we don't check it, we are doing something wrong. It's important for us as a doctors to have the correct vocabulary about it. The gross motor, the fine motor, the speech and language, the personal and social communication, the most important parts, I mean. So let's go ahead. Please read these situations, okay? The common infection diseases, I mean, these ones are expressed into the book I'm using for, but of course it's different in every country. We have not the same chart of pathologies in Latin America than Central America or Europe maybe. So in that order, we must consider that we have some situations, some diseases that are common worldwide, but can change specifically in the situation we are living for, okay? Maybe, Mercedes, can you read it? Mercedes Joyce?
Yes. Common infectious diseases. The disease is morbidly rubella, commonly measles, rubella, German measles, varicella, chickenpox, infectious parotiditis, mumps, pertussis, whooping cough, acute laryngotracheitis, croup, escarlatina, scarlet fever, rheumatic fever, tetanus, lockjaw, and poliomyelitis, polio.
Okay, thank you, Joyce. For example, we have here the chickenpox that is very common worldwide. Rubella here in Bolivia is rubella too. The German measles is an European expression. Croup is also described in American books as croup, but the correct term is the acute laryngotracheitis. And well, we know it. The scarlet fever, the scarlatina, the lockjaw, that of course it's not a common situation to be seen down because of vaccination, right? Let's go ahead. Now, a very important topic to talk about is the celiac disease. We have two ways of writing down this specific situation, COE or just CE. The United Kingdom expression, COE, celiac disease, it's pronounced the same as the United American expression, the celiac disease. Pronunciation is the same. Maybe just this one that are getting confusion, but that's not as important. Just the objective is the information we have about it, okay? Mario, can you read this first box, please?
The first one.
Yes, the white one, this one.
Okay. Celiac disease is a disease of the small intestine caused by sensitivity to gluten. It can present at any age, but in infancy, it appears after weaning onto cereals containing gluten. The clinical features include diarrhea, malabsorption, and failure to thrive. There may be signs of malnutrition, and there may be some abdominal distension. There is delayed growth and delayed puberty, leading to short stature in adulthood.
Thank you so much, Mario. So we have here the Black words that are expressing us the new vocabulary, of course, for understanding and catching up, okay? And John Harold, can you read the other chart list, the gray one, the vocabulary meanings?
Yes, sensitivity to having a negative reaction to winning or wine, changing to the diet from milk only to solid foods, clinical features, the symptoms and signs of a disease, malabsorption, poor absorption, malnutrition, poor diet, nutrition, adjective equals malnourished, thrive, grow strongly, distension, swelling, delay, later than expected, failure when something that is expected does not happen, and stature, size, especially height.
Perfect. Thank you so much, Harold. So having the meaning of these specific ways of expressions, we have more key down some paragraphs expressing this kind of diseases, I mean, that are common for our kids, for children in our countries. Okay, that's why we must keep working, just keep working, just keep reading, don't go out. Today, it's a very common situation to talk about the celiac disease that, well, not as a new disease, I mean, but it is a situation that, of course, changes all the nutrition ways we could get for kids, for children. They must learn how to eat, what to eat, where to eat, and the most important, the combinations about it. It's similar to the lactose intolerance. I mean, there was no situations that were so common when we were kids. I mean, for example, when I was a kid, and now we must consider this kind of new situations. And these new situations are well explained with these expressions we are getting in these charts. Okay, so just keep working, don't lie, don't leave these opportunities. And as I was telling you, we had lots of jobs to make, of work to make. Okay. Now, this is all the presentation for today. I know it's long, not as the last one as we had, but it's important to keep on reading. Okay. I'm taking the book that the institution sent to me, but I'm trying to use more details for understanding, to complete the information in order not to get in confusion, but get better ways of expressions. So I think it's important to get the correct documentation, okay? In that way, of course, I'm going to send you the presentation in a few minutes. Give me a chance to correct some details in the basis in the slides. And that's all. Any question you have about it, something you would like to comment, maybe? Tomorrow, the workshop, of course, is going to start at 8 p.m., please. It's not possible for me to start at 7:30 as we were doing at the beginning, but now I need to come at 8 p.m., okay? And tomorrow we're going to talk about the case report that was homework. I'm going to show you the keys and the ways of doing it, of correcting it. That's all, I think. I received 1, 2, 3, 4, 5, 6, 7 reports or 7 students that's in my day report. I'm sorry for expressing it that way. The rest, of course, can do it I can wait for it. There's no problem, but of course the score is not gonna be the same. It's not a useful situation. Any comment you would like to do? Something you would like to say? I don't know. If there is no question, maybe a question, nothing? Okay. So let's make the diary pool for assistance. And I think that's all. It's sent. Can you watch the diary pool?
Yes.
Okay, thank you. Okay, we are 10. Yes. Perfect. Thank you so much. We are 10 students now. Perfect. 1, 2, 3, 4, 5, 6, 7, 8. Yes. Thank you so much. So I sent it. Any question you have, we can talk about it tomorrow. Don't worry. And have a good night. And don't forget, I'm here for asking you. You can send me a message if you consider it's okay.
Thank you. See you tomorrow.
Okay, see you tomorrow. Bye.
Thank you. Have a good
Bye.
Bye-bye. See you tomorrow.
Bye.
Have a nice night. Bye. Okay, that's great. We can finish it. Bye bye. See you.